but I can tell you that men as young as 30 are now coming to see me because they have low testosterone. I don't know what's going on. Is it the food? Is it the radiation from cell phones, cell towers? Is it the fact that they carry their cell phone in their back pocket and it's causing damage to their testicles? I don't know, but there's a variety of things going on. But low T, low testosterone, andropause is affecting younger and younger people. I'm going to talk about what male andropause is. I'm going to talk about how a drop in testosterone affects your aging. And I'm going to talk about the many effects of testosterone and the forms of how you can replace testosterone. So here's it. When you're young, in puberty, right around the age of about 11 or so, the brain says, I have 12 to 17, the brain starts putting out LH and FSH, which is a stimulating hormone, to tell the testicle, hey, it's time to mature this young man, and his divorce is going to get a little deeper. He's going to start thinking, he's going to have body odor, and he's going to start growing hair at different places. So it triggers. Right around that time, the brain says it's time for that development, and then his testosterone starts to go up. And the other androgens, which are DHEA and androstenedione, those also go up. And that's what makes a young man turn into a man. The size of his genitalia also increases. So everything is happening over this period of time. He's getting taller, he's getting his growth spurts. So testosterone is the principal androgen, and it's what makes men different than women. So now, they've enjoyed the high testosterone until about close in the mid-30s, 40s, and the hormone starts to decline. And then what they notice is now they can't perform as well sexually. They realize now that they are not as sharp cognitively. Their memory may be a little less or slowed. They may have to think longer to remember things. They start getting the abdominal truncal obesity. Well, you know, they used to eat this way when they were in the 20s and 30s, and they never gained weight. But now the tire starts coming. Their muscle mass, because now they don't even have the energy. They don't exercise as much. Even though, you know, there's a shift. Lots of educated people, they're making sure that they're fighting the aging process by making sure they're exercising and eating better. So it's all about being an educated consumer, because you're going to produce better health than the uneducated ones. You won't eat McDonald's every day. You won't drink soda pops. You won't drink juices like it's going out of style. And you won't eat cake. Cake is my biggest thing. People love cake and ice cream, but those things make you fat. So anything that's a sugar is going to turn on your insulin, and you're going to start storing fat. Understand that. So now you have testosterone in your brain, in your heart, in your bone, and your muscle. You have it more places, but I'm just emphasizing those. You have testosterone receptors. So the testicles produce testosterone. It only has two functions. The male testicle has two functions. What are they?
Produce sperm.
Produce sperm. Exactly. And the next thing, what I'm talking about, testosterone. That's it. It does nothing else. That's right. And the reason why it's outside the body is because sperm needs to be cooled. So that's why it's an extension of the body. It's outside of the body. The testicles are. So as these hormones decline, you can see the aging process takes place. So why would you just let it keep going down, 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 and you're becoming this way, when you can maintain your vigor well into your 80s by replacing it? Right? Okay. So here's male menopause. It's not as sudden as female menopause, where they wake up with hot flashes and they're very dramatic. It's a subtle thing. So you'll never hear a guy say, I think I'm going through male menopause. They won't do that. It's more or less they just kind of start losing their zeal a little bit. That zeal for life, they get a little bit more sad. And that's the thing, sadness, you know. Men, they'll be like, you wonder why they're just not as up and going, peppy anymore. That's one of the first things I noticed, you know, just kind of going through the motions. But it's just as severe in long-term problems. When you have low T, your heart ages. In China, they use testosterone. Remember, the heart is a muscle, and testosterone builds muscle. In China, when someone has heart failure, they actually use intravenous testosterone to help with the contractility of the heart. And in this country, we have hypertension that causes congestive heart failure. So the testosterone actually increases the force of the heart and prevents people from going into congestive heart failure. So think of that. That's one of the reasons. If your heart's aging and it's losing its function and it's working like this, you won't be able to run a 5K. You won't be able to do, you know, have sexual intercourse with vigor, right? I mean, you'll be kind of slow. I'm just teasing. So when it's low, you drive. You don't have the drive. You don't have the competitive edge. You can get more sore in your muscle stiffness. And I talked about the truncal obesity, which is the most visible aspect to low T. And you get visceral fat, which is fat around the organs, the liver, the kidneys. And that fat, that's the fat that's mobile, that goes into the bloodstream and causes problems. So andropause is a deficiency and it's lethal. In 1990, they confirmed that 1/2 of healthy men between the age of 50 and 70 have a testosterone level below the lowest level in men's 20 to 40. So there's a big drop-off once you hit 50. So which one comes first? Is it that your testosterone drops and then you get old? Or you get old and then your testosterone drops? Either way, it's replaceable. It's a very important point in anti-aging. It's one of the strategies that we use to maintain people's vigor. You get diabetes when you get obese, brain dysfunction, heart disease, you become more frail, and you get fractures. And obviously you get a risk for cancer as well. Bone fractures when you have low T. The risk of cancer goes up, not down. What causes prostate cancer? This is a big point. High estrogen in men stimulates those prostate cells, not testosterone. Testosterone is a growth hormone, but it's not what causes the prostate cancer. It's the estrogen that causes it. It stimulates the prostate cells, and it causes those cells to divide. So you want to keep your estrogen down and keep your testosterone up. So middle-aged men will experience depression, fatigue, abdominal weight gain, alteration in their mood and cognition, a drop in libido, erectile dysfunction, enlarged prostate from the fact that the estrogen is stimulating the prostate, making it larger, and heart disease. And it can happen as early as 50, or it can happen earlier in men who smoke, who have unhealthy lifestyle. So you go to a doctor and you say, "Doctor, I just don't feel that good." He says, "Okay, I think you're just depressed. So let me give you some antidepressant. I'm anxious. Let me give you some Xanax." And here we are, we go down this path where we're treating these symptoms of a very common condition. You know, we're giving people drugs for this stuff. I talked a little about the estrogen. This is the slide that tells you. Estrogen goes up in men as they get older because the body fat converts it. It's an enzyme called aromatase that converts testosterone to estrogen, drops your libido, increases your risk of heart attacks and strokes, and causes the prostate to get bigger. Testosterone stimulates the libido. It helps your libido. It helps you to think about it. Now, I want you guys to understand that when you have a libido, it means that you have a desire for sex. It doesn't mean that because you have a desire that you can actually perform. Performance is based on your ability to have an erection. So you can have a normal libido, but you have erectile dysfunction, so you cannot have sexual intercourse. So that's a vascular problem most of the time, where the blood flow is just not getting there. That's why what drugs now are on the market that increases the blood flow to the penis? Which one? Viagra. What else? Cialis. And Levitra, right? They have actually injections of alprostadil, which causes the penis, the blood vessels in the penis to expand. And many people are on that as well because the Viagra and those drugs don't work. But arginine and nitric oxide, those are the things that increases to improve blood flow to the penis. And unlike women, a man really can't have intercourse unless he has an erection. A woman can still have intercourse, right? You can fake it. But a man has to be able to get that good circulation. So part of it is not only having the desire, because having the desire will stimulate the blood, but it doesn't work when you have vascular disease as you age. So you have to take something for that as well, okay? So some people say, Doc, I feel better, I have more energy, but I still have ED, and so we have to treat the ED too. It's separate, right? The testosterone is going to make you all of a sudden have rock hard erections, and we're all adults here, which is what we have to talk about. And I talk very candidly with my patients about this type of issue, and it's a major part of feeling alive and feeling well, is to be able to perform. All right. So, finishing up on men, it's very important for libido. Testosterone does not cause prostate cancer. Estrogen does. I went through that. PSA is no longer recommended when a man comes in. The digital rectal exam is still done to check for lumps and bumps in the prostate. But they don't recommend, the U.S. Preventive Task Force do not recommend them doing PSA. Because the most common reason why a PSA is elevated is benign hypertrophy or prostatitis, an inflammation of the prostate, not prostate cancer. And what they found is that because these PSA were elevated, they were bringing in men to get prostate biopsies and ultrasounds and doing all this tests, and it wasn't cost effective for them to pick up one cancer when they've had done all these tests. Okay, so they don't recommend it. I still do it, but the digital rectal exam is a very important part of it. Okay, and obviously family history, because African American men tend to have a much higher incidence of prostate cancer as well. So when you lose testosterone, mental decline, low levels cause the loss of ability to concentrate. You become moody and emotional. And you saw at weddings, you'll see a man crying at weddings. And maybe his daughter, I understand. You're very emotional about it. But still, it's, when you start bawling, it really is because your hormones are not balanced. And you probably have more of a higher level of estrogen. You become more timid. You resist any type of confrontation. You feel more weak. Your memory. Okay. You want to share that? You want to share it? You don't want to hear it. Oh, sorry. We're talking to me? All right. No? All right. So it's private conversation, I guess. I'm not supposed to hear that. Feeling weak, unrest, and so on. Testosterone in the heart, I mentioned before, it's very important for the heart function. And it causes vasodilatation. It opens up the blood vessel so you can actually have better blood flow to the heart muscle. So here's a conventional wisdom. We talked about conventional wisdom for women. This is for men. Drugs are the conventional wisdom. So when a guy has high lipids, they give him lipid-lowering drugs, such as statins. They put them on hypertensives. They use hypoglycemic agents when they have blood sugar issues. They'll use anti-obesity drugs like fen-phen and phentermine. They use blood thinners and anti-inflammatories. Or if those don't work, then they do the roto-rooter. They go in, they do a cabbage, or they put stents in to clean it out. And it's all vascular disease. You know, if you have blockages in your leg, they do what they call a fempop. If it's in the carotid, they call it a carotid endarterectomy. They do cardiac catheterizations, angiogram, balloon dilatation. Now, when people have blockages in the brain, they can actually go in there and put stents in the brain as well. So this is all vascular, but this is a lifestyle disease. You don't have to get hardening of the arteries so bad that you get a stroke or a heart attack, or you knock out your kidneys. You eat right, you exercise, you do the right supplementation, the right balance your hormones. You don't have to die of the nation's #1 killer, which is heart disease. The integrative approach, once again, stress reduction. You're going to see that when you come, if you come here, you'll realize we focus a lot on reducing stress, because that is what's causing a lot of the metabolic derangements that you see in your body. Nutritional supplementation and exercise. Relaxation techniques, massage, I talked about some of those. And then your diet. You need omega-3s, it's very important. Lean protein. Animal fat is never good, so always, I don't have any problem eating steaks, but you want to do a lean, you want to trim the fat. Don't eat the animal fat. People say, oh, that's the best part. Eating fat is not healthy. That's where all the hormones are stored. That's where all the heavy metals are stored. So you don't want to eat fat. Even skin is not that good. And then you need a good wellness exercise program. We have our program here that we can show you how to live and how to prevent disease through our 8 Weeks to Wellness program. 8 weeks. You get massage therapy, exercise, you get some meal replacement, you get your fish oil, chiropractic, which is all important. It's a big program. I'll give you a brochure on that if you're interested. So here, these are the prescriptions for Andropause. They used a patch. It only has a couple of dosages. And they have to, what they're patent here is not testosterone, they're patenting the delivery system. That's what they do. And then they add a little molecule to it, which makes it different from testosterone. They always have to do that to patent stuff, okay? So I don't normally recommend that, but if somebody doesn't have any money and the insurance is going to pay for it, the testosterone patch costs about $300 per month. If you have insurance, your insurance will probably pay most of it, and you'll have your highest copay, which would probably be around $60 to $80. If you do bioidenticals, it's much less than that. It's not $300 for a 1 month supply is about $50, and then you're getting the real thing. Yeah, so the pharmaceuticals basically are focused on one size fit all. They just have a couple of dosages that you can order and prescribe. You cannot taper it the way you can with bioidentical, and they're pretty expensive. Now, synthetic testosterone, such as danazol, these are what the bodybuilders shoot themselves up with. They can get liver cancer from it. Should not be used, and it's in red. It causes cancer. So I don't do any of that. Natural bioidentical testosterone is identical to the testosterone made by your testicles. There's no difference, and it's compounded. And you can do it by injections, you can do it by pellets, or you can do it by creams and gels. And that's the normal dose. Pellets are done twice a year. The creams are put on every day. So here's what you can expect. You can expect your erectile dysfunction to improve. It probably won't get completely better if you have vascular disease, but it will definitely improve. Cognitive function will improve, your mood will improve, blood flow to the brain, reduce dementia, Alzheimer's, reduce heart disease, reduce inflammation, reduce prostate cancer, because they go back, and when they check people who develop prostate cancer, they all have low testosterone and high estrogen. So testosterone is actually preventive for prostate cancer. As in the women, we have supplements, natural stuff God put on earth to help with testosterone. You guys may have heard of chrysin or muropalma. Those are all good things. Nettle root is good, but they're not as good as the real thing. But I always mention those. All right? So what I'm going to spend the next 5 minutes on are pellets. I want to talk about pellets. I will have a lot of women and men who are on pellets. A lot of them start with the creams, and then they choose to go to pellets. Now the pellets work because once you put it in underneath the skin, if you're going to exercise and your heart rate's going to go up, the blood flow to your skin increases. So it's more on demand. You can get it. When you put the cream on, you put it on in the morning and it's good, but then it fades. So the next day you got to put it back on. The injections, when you do the injections, you have to do at least twice a week to get it somewhat physiologic. But when you give it, it goes up initially, 1-2 days, and it drops. 3 days, goes up again, you have to give another shot. So you get more of a bell shape. When you get the pellets, it goes in, it stays there, and it stays for about 5-6 months. For women, about 3 or 4 months. So that's what I like about the pellets, because of that. It's somewhat more effective, it lasts longer, increases the bone density quicker, and it's painless once you get the anesthesia, and it's painless. One injection gets it in, and it's delivered 24/7. Symptom relief versus physiological change. With other delivery methods, they control the body and create symptom relief. With pellets, the body is better able to regulate the release of hormones over time. So here's a good example of what I'm saying. These are with the implants. This is where the level stays. This is with the patch or the cream up and down. And these are when you take it orally, which I never recommend taking estrogen orally or testosterone because it has to go through the liver. So I don't do that.
That's why they launch pills for it, like daily pills.
Exactly, yeah. Stimulus the liver. So for women, 3 to 4 months, they'll get pellets, and for men, every 5 or 6 months. Here's a slide that really shows you the effect of pellets on bone density. You see, patches and creams about 5% increase per year, but with pellets about 8%. And here again, it shows increase, the bone density increases. You can see with the patch, it's about this. With implants, it's that, vertebral and femoral. So in conclusion, wrapping up, andropause is the reduced production of testosterone caused by aging. And andropause can be effectively treated to slow the aging process by improving your mood, your body composition, reducing heart disease, and improving sexual function. Bioidentical hormones is safe and effective alternative given to the right person. Obviously, for women, we do mammograms and pap smears, make sure nothing is brewing before you get pellets. With men, we will check your PSA and do a digital rectal exam to check your prostate. So you have to, and then we do your lab work, a full component to check your liver, kidney, make sure everything is working properly, and then you can get started. Compounded pharmacy should be viewed as a low-cost option to the FDA-approved synthetic drugs. Very, very important. This is where we're located. We work, it's actually strictly, we don't work with any other compounder for our bioidentical creams and pills, then Atlantic City Pharmacy. So that is where we go. That's where you would get your medication mailed to you, or you can pick it up. This is where we're located. This is our website, ANWANRegenCenter.com, and we pretty much do everything. All right, so I'm going to open it up for questions.